Let me just say thank you all for joining in. What a beginning of 2021. Unbelievable. Talk about Operation Warp Speed. We are definitely in it. And just want to say Happy New Year to everybody. I'm hoping that 2021 it's much better than 2020. And obviously, as partners, we'll get through this. I thought it'd be important, as we have in the past, to get you all up to speed, create a forum here so that we could update you all on what's happening with the County of Riverside, and then give some time for some Q&A. So maybe an update for about 15 minutes, maybe some questions from leadership, about 20 minutes or so, and then just so that everybody is aware, media's on, and I believe they may be as well streaming this live, and we'll open up about 15, 20 minutes for them towards the end for questions as well. And we have our folks that are on the line here on the Zoom call, besides my staff, my immediate staff. We also have Kim Saruatari, our Director of Public Health, Juan Perez, who is our interim CEO, Brooke, I believe is on. I don't see her, but I think Brooke is on, and she'll be discussing communications and media efforts. And then Lisa Brando, our COO, on any other technical maybe questions that pop up that she could provide some responses to. And I understand there's concerns around the vaccines, obviously workforce, test sites, funding streams, concerns around guidance and coordination at every level, communication efforts. So we're going to try to cover as much as possible within the hour. Whatever we don't cover, folks, and if you still have questions, please write us. And media, if you have questions, please let us know so that we can point you in the right direction. And I do believe that staff will be taking interviews later today if need be. And so with that, I'm going to go ahead and turn it over to Amy. I believe you're taking care of and hosting this Zoom call, Amy. But with that, I believe Kim Saruatari will be speaking first. Kim, are you on?
I am, Supervisor.
Go ahead, Kim.
Okay, thank you. So good afternoon, everybody. Thank you for being with us today. I do want to provide an update focusing mostly on vaccine because that is the topic that's on everybody's mind right now. Before I jump into the vaccine issues, I just want to give quick numbers. Our raw case rate is sitting about 130 cases per 100,000 right now. And our overall positivity for the county is at about 26%. So over 1 in 4 people that we're testing are testing positive right now. That percentage is slightly higher in our lowest quartile areas. So our most vulnerable communities, it's sitting at about 27 to 28%. So just a little bit higher than the general community. We are continuing to test. We have Curative that is doing testing for us at many of our sites. They're working very closely with us. And so that is continuing while we are ramping up our vaccination efforts. We still want to continue to test folks. So that's kind of where we are with testing. So just to pivot and get into some of the vaccine details. So one of the questions that we're asked a lot is, what is the plan for vaccine, and were you planning for the last 8 months, 9 months that the pandemic has been going on? So one thing I want to make sure everyone knows is we actually have been planning for mass vaccination and mass medication distribution for many years. So we actually have sites that have been identified. We've done site security plans in many locations across the county. So that has been done. But what we are finding is we have to now update those based on the specifics of this virus, right? So some of our walk-up sites that we had we can't use because this is a transmissible virus. We can't have people in close quarters. We need to have big enough areas, all of those things. If we're doing drive-through sites, then we need to have adequate parking and adequate so that we can keep people for 15 to 30 minutes after, and we need to have appropriate traffic control. So the layer of complexity is what we are working through as we know more about how the vaccine is rolling out. So on top of that, like all of you, we were working under some assumptions about the vaccine rollout from the federal and state government that are changing and are a moving target regularly. And I know that the move to include 65 and older caught a lot of people by surprise. And to some degree, even us. We knew that there were conversations going on, but we did not have a definitive answer that we were necessarily rolling that out until the governor made his announcement. So, we're all in this together from the federal to the state to the local level. And so we are figuring out the best way to make this work. And at the end of the day, our goal is to get as many vaccines as possible, as quickly as possible, and as safely as possible into the arms of our Riverside County residents. A couple of things that I want to mention. One is vaccine allocations. So if you look at our RU Health website right now, you will see that we have received 114,825 doses of vaccine into the county. So what happens is the federal government gives the state an allocation of vaccine, and then the state allocates it out to the counties. And so the state has received about 2.9 million doses of vaccine. So our allocation is pretty much on par with our population percentage of the state. We're around 6% of the population, and we've received about 6% of the vaccine allocation. So when we get our allocation at the county level, what we do is we look at who are approved providers in the county, and we allocate vaccine to them. And then we keep some for our mass vaccination clinics, or what we call pods, point of dispensing. There is an exception to that, what are called multi-county entities. So the Kaisers, the tenants, the systems that are in multiple counties, they are getting direct allocations from the state. But other than that, it's all coming, the vaccine doesn't come to us, but the allocation process goes through us as the local health department. So we make recommendations on who should get vaccine. We send it back up to the state, they approve it and send it on to the feds. And then those entities, if they're large, they will receive vaccine directly from the manufacturer. If they're small, meaning like Pfizer, for example, they send out in doses in shipments of 975. So if a facility is getting more than that, then they'll get a direct shipment from Pfizer. If it's less than that, then it comes to us and we have to redistribute the smaller allocations. And then, as I mentioned, we keep vaccine for our pods. And so over the next 4 days, we are going to be announcing some additional vaccine clinics. And what I can tell you is that as of right now, we have 14,346 doses in our hands as public health. And that is just enough to get through the vaccine clinics that we have planned through Sunday. And by the end of Sunday, we should be pretty close to out of vaccine as a public health department. We typically get shipments on a weekly basis, but right now we do not have a regular allotment that is coming through. So the supply chain is still maturing. And so that's one of the challenges that makes planning very difficult. So we don't know when vaccine will be arriving with certainty, and we don't know how much we'll be getting at any given time with any level of certainty. We estimate it's around 35 to 40,000 doses a week, but that's not a guarantee. That's just kind of our planning assumption. And so when you think about, as of today, there are about 175 to 180 providers that are registered in the state system to be eligible to receive COVID-19 vaccine. That's not a lot of vaccine to go around. And I should mention that people who are interested, and I know you all are getting questions about this too, if a provider wants to be a COVID-19 vaccine administrator, they have to sign up and they have to be approved by the state of California. It's not us at the local level that is approving that vaccine provider status. So in order to be a vaccine provider, they have to be signed up and have logins to the California Immunization Registry. They have to be able to demonstrate that they have storage capacity and experience or the ability to handle vaccines. There are several things that have to be demonstrated. So we are happy to support providers and provide assistance in that process. But ultimately, it is the state of California who approves those. And then once they are approved, then we can allocate vaccine through the process I described to you a few minutes ago. So if you look on our website again, so we've received 114,825. We only have, as I mentioned, 14,346 doses. So the rest of those doses are either administered or they are out in the provider network in the process of being administered. So we are not sitting on vaccine as your public health department. Our goal is, as vaccine comes in, we're getting it out within a couple of days through our pods and through distribution to the provider network. Ultimately, our long-term goal is to transition all of this over to the traditional provider network so that people go to their doctors and they can get the vaccine. But with the limited supply right now, we feel it's important for us to supplement with the clinics that we have, with the mass vax or pod clinics. I also want to mention that based on our estimates, there are about 700,000 individuals that are eligible for vaccine right now. And so given the number I told you, we've only received 114,825 into the county. You can see that demand far exceeds supply. I know that there have been a lot of frustrated residents over the registration system. I do want to let everyone know we have conveyed those up to the state. It's actually a state system. And so we are, all of us in every jurisdiction are working with the state to try to get them to make modifications to the system. But what we request has to also work for everybody else in order to have that modification made. So those are ongoing conversations we're having. And most notably things like tell people up front when the clinic is full so that they're not going through the whole process and then they get a notice saying the vaccine clinic is full. I know that's frustrating for individuals. And so we're trying to get that changed. We also are working to beef up our call centers, and Brooke may talk about this a little bit more, but we're working with our Office on Aging, 211, and potentially other partners so that we can assist and have people that are readily available to answer questions and help people who either don't have access to the internet or are having difficulty navigating the system. Just a couple more things I want to mention. So in general, we're thinking about our vaccination efforts in 3 buckets, right? So there's the pods that we're working on. There's the provider network for people that, providers that can get approved to distribute the vaccine, and then we allocate to them. And then the third bucket are our mobile teams. And so our mobile teams are really what we are relying on to get out to our hard to reach populations. So for example, our farm workers, and I think I saw Janelle on this line. We've been working with Janelle and many of the growers to figure out a system for vaccinating that population, because obviously they're a vulnerable population for the type of work that they're doing and a number of other reasons. And we know that they don't have the flexibility to show up at one of our sites necessarily to get vaccinated. So we want to make it as easy as possible for people to get vaccinated. And so we are standing up mobile teams as well. In the particular situation of farm workers, we're partnering with Desert Healthcare Foundation and talking with other providers, because as a county, we need to work with providers and partners to be able to do this. It's really, the vaccination campaign is, it's all hands on deck, right? I mean, we've never had to scale up like this in this short amount of time. And so we really need as many partners going forward who are willing to work with us and help amplify messaging, but also the ability to get vaccine in people's arms. So as of right now, the county is technically in phase 1B. So we have everybody in phase 1A is eligible to get vaccine, as well as in phase 1B. Again, our rate limiting factor right now is vaccine. So as we get vaccine, our goal is to get it out the door in a couple of days. And that makes planning difficult sometimes. So we have sites that we have identified. We will be identifying more sites going forward, and trying to get vaccine and make it widely available. So I think I will. Oh, the other thing I wanted to mention, sorry, just one more thing on the website. So one of the questions we get asked a lot is how many vaccines have been administered. And so that is a hard question to answer for a number of reasons. The first is vaccines are supposed to be entered into the California Immunization Registry, but providers have up to 3 days to enter that data. And so there is a lag in the data. And we also know that that data entry is not perfect. And so we know that what is in there is a real underestimate. And then on top of that, we know that Riverside County residents who work in other counties are getting vaccinated in other counties, just like our residents who work in other counties, or excuse me, people who live in other counties and work in our hospitals, for example, are also getting vaccinated. So to be able to really nail down the number of shots administered is challenging. And that's something that we're also trying to work with the state so that we can get better data. But what I can tell you is that as soon as we get vaccine, we're trying to get it out into the community and into people's arms. So I think with that, Supervisor, I'll stop and we can turn it over to whoever's next in the briefing.
Sure. Thank you, Kim, for that. Let's just go ahead and move forward, move along here, and then we'll open up for questions after Juan and Brooke speak on their items. Juan, did you want to elaborate more? Any other points you want to make?
Yes, thank you, Supervisor, and good afternoon. And just briefly, a couple of things. Kim did a great job briefing all of you. We have, and we very much appreciate that we have received a number of offers from businesses, from city partners, from the community on additional sites. And please keep those offers coming in. And we're going to make a note of that. At the same time, the challenge is until we get an expanded supply chain where we can then be able to operate additional sites, we're not going to be able to keep adding to the number of sites. One of the priority areas that we are indeed looking at for another location is in the Western Coachella Valley. So that is something that we're taking a very hard look at. And when we're at the point to hopefully here soon, that we have a more consistent supply chain where we can then expand our locations, we will be looking to do that. I do want to just kind of go back and put a couple of things in further context that Kim mentioned. And I think she started off reminding us as well that while we are certainly working hard and full speed ahead on the vaccine rollout, we still are very much helping to manage a crisis in our hospital system. We still have very much interest in testing. And so we have really these multiple areas at once that we are working to actively manage all of them. One other point of reference. So we may all remember that it was about a week ago or so that there was a interest in trying to make sure that all the folks in phase 1A were vaccinated within 10 days, right? So as Kim mentioned, that's about 110,000. We have in phase 1B, the prior phase 1B, we had, and Kim can correct me, about another 500,000 individuals identified in that. So at the time, we were looking at roughly a 6-week time frame to be able to vaccinate, pending availability of supply, all of the folks in phase 1A and phase 1B. So certainly with the change in eligibility from the state to then increase and allow our senior population over 65, that has been a very dynamic shift for us that we are working to respond to. So it has led to a situation that we're working to manage. We have greater interest, a lot more folks eligible to sign up, and we are working hand in hand with our senior community as well to facilitate that through phones and other means of communication, so they're not just having to rely to go on an app. But I think it's important to stress that the eligibility increase has not come with an increase in the supply chain. And that is a challenge that we are looking right now to be able to manage. Our goal is to get it out within a day or two, as Kim mentioned, of whatever we receive here at the county, and much of the way that we distribute that is through our private sector partners that get about 75% or so of those vaccines for distribution. So I'll conclude my comments, Supervisor. Be happy to answer questions later, but perhaps Kim can give an update. I'm sorry, Brooke can give an update on some of our public outreach efforts and website changes you're going to be seeing soon.
For sure. Thank you, Juan, for your update as well, and for bringing up the point around sites. And I want to thank all the folks that are reaching out to help in rolling out the vaccines as well. Fred Bell, for example, has come forward and offering the Palm Springs Air Museum under the Convention Center potentially could be a site. Obviously, Golden Voice has reached out as well. Those are all possibilities, but obviously it all depends on the vaccines. And with that, I want to make sure that we also are answering the questions that are popping up. Amy, if there's a way in which maybe Kim or Brooke, our team, can respond to those questions, that would be helpful along the way, just because of time sensitivity. Brooke, are you on?
Yes.
By all means, Brooke.
Good afternoon, everyone. We have issued out news releases in both English and Spanish when there are announcements of these public health vaccine clinics. So the other day, Wednesday, we issued out a news release at the same time that the appointments went live. And as we know, those appointments were completely filled within a couple of hours. Today, as Kim mentioned, we will be updating on our website this afternoon additional vaccine clinics and appointments. We will be issuing out a news release at that same time. It will go out in both English and Spanish to our media partners. So we're really relying significantly on our media partners to relay this message to the community so it gets it's broadly distributed on all of our broadcast and print media platforms. We're also posting, of course, on our website, as Kim mentioned, which is ruhealth.org, and then go to the vaccine tab. We continue to make updates to this vaccine page to make it easier for people to navigate. One of the things that we are working on right now is adding a notification when that specific page is updated. I know that's something that people have asked about, so that's something we're currently working on, and I hope that I can have an update to share on that shortly. But as I mentioned, the news release will be going out this afternoon at the same time that the appointments go live. We also post, of course, to our public health social media channels at the same time. So when this information goes out, then it is a first come, first served basis for those appointments based upon the eligibility of phase 1A, all tiers, and phase 1B, tier 1. Now, for individuals who need help making appointments, and I know this has gotten a lot of attention, we do have our Office on Aging department for seniors to call. We also have 211. Now, I know that both of those numbers were heavily impacted with a lot of phone calls the other day, and there were people who are waiting for some time. We have added additional resources to 211 to cut down on that time frame. The news release will specifically direct people to the 211 number. If people still call the Office on Aging, they will still have people there to assist and support, but officially we're directing everybody now to the 211 number for additional help. And that covers it as far as how we are putting out information on when these clinics are available.
All right, thank you, Brooke. We're getting quite a bit of questions, obviously, from folks, and I'm going to lean on the team here to respond to these. This is from Pam. Does each distribution point have the means on hand to respond to any severe reactions people might have? Are vaccines based on first dose only? Will someone ensure the second doses go out in the same numbers to the same places?
Yeah, so Supervisor, I can answer those for you. So yes, on site at all of our pods are kits to deal with basic medical emergencies. On top of that, the people that are working at the sites are nurses and EMTs and paramedics. So they are very used to responding to medical emergencies. And then we also have had a couple of situations where we have had to call 911, not because of vaccine reactions, but because of other medical issues that have come up. And so the staff that are on site are able to care for the person and provide adequate care until the ambulance gets on scene. So we do have that network set up. And at some of our larger sites, we could have an ambulance. The problem right now is because of the hospital surge. The ambulances are also really busy. And so we're trying to keep them in the field doing the work that they need to do. So it's that balancing that Juan spoke about. In terms of second doses, so the state allocates second doses separately. So the allocations are based on where the first doses go. So as we distribute out to providers, we make sure that they have second doses also when they come in from the state. So there is a separate network for the second dose system. And we are telling people as they come to us, they can get their second dose with us, but if in the meantime their provider gets the vaccine, they can go to their providers for the second dose, or vice versa. And we can, we have the ability to move vaccine around as we need to.
Thank you, Kim. There's a follow-up question from Kathleen, and we may not have a full response for this, but will people who are due for their second shot have priority for signups to assure effectiveness of this? And could they get a second shot appointment when they receive their first shot?
Yeah, so that's a great question. So we're not having people sign up for second shot appointments when they get their first shot because of what I just described. People might find another location that they want to go to get their vaccine. And so we don't want to hold appointments and then not have people show up, because then that adds to the log jam of trying to vaccinate people. In terms of giving them priority, that is something we've been talking about. How can we do that through the system? As I mentioned, the registration system is not ours. And so those are ongoing discussions. I will say, though, that the vaccine, although it's ideal for us to get it within 21 days for Pfizer and 28 for Moderna, if it's a little bit longer, the vaccine is still going to be effective. So we're working through those details now as we get into looking at second doses for the pods that we've held.